Okay. Hi, good evening, everyone. Welcome once again to a Thursday night, and it's our Facebook Live tonight. But our topic for tonight is all about life lessons on mental health conversation. So, with us tonight is a wonderful guest. But before that, I just want to share with you our topic for tonight. You know that stress is now what the WHO considers a global health epidemic right now. And so, not only talking about stress, but how does stress become worse, which is now a mental health disease and mental health illness. And so, with us tonight, I have such a wonderful guest. She's also my colleague from my digital business, but she's also a nurse and she's a mental health advocate. And so, I invited her tonight. So, I'm so glad that she said yes tonight for this conversation. And but before we introduce her, let me also introduce our guest co-host, Miss Bay Gonzalez. Hello,
Hi,
Bay.
it's me again, your monthly guest. Yeah,
You're not
it's
my
me.
monthly guest, you're my monthly co-host.
Co-host. Right, right.
You own this show with me. Anyway, thank you so much, Bay. Say hi to everyone out there. And of course, our guest tonight, I want her to introduce herself. She started with last month when she guested with me on my Facebook Live, and I got to know her very well. And she's a great person, a mom of three. She's a registered nurse, and she's living all the way in Australia. So, shall natin tonight, okay?
Yes.
Now, in our conversation, we have an important guest.
Wow
Oh,
naman.
So, let's
it's my
please
pleasure.
welcome Miss Maricel Nieto Carney. Hi, Maricel. Please introduce
Hi.
yourself to
Hi, good
everyone.
evening everyone. Magandang gabi po sa inyo mga nanonood. Either this is live or replay later on. Kamusta po kayo? Hopefully, you're doing well and safe. It's Maricel here once again. I'm based here in Sydney, Australia. I'm a registered nurse by profession and on the side, I'm a digital business owner.
Wonderful. Thank you so much, Maricel. And of course, when we talk about being a nurse, we normally think only of physical health.
Yeah.
But what's so special about Maricel is that her focus is really more on mental health in terms of her public service in terms of in the hospital there in Australia. And so when we talked about now, and like you said, when we look at how we are right now, do you know that there is 1 in 5 adults and children are undergoing mental health disease or health
Mm.
issues? And it's no joke now that suicide is a number 2 problem for people ages 15 to 29 years old. Can
It
you
is
just
true.
imagine?
Yeah.
Yeah. And
hmm
and the fact that there's so much bullying nowadays, is more so now with
Yeah, social
technology.
bullying. Yeah,
Yeah,
Yeah.
exactly. And it's
online.
worse. It's
hmm
getting worse. And bullying now is easier to do because you don't have to be physically present to
I know.
bully, right?
Yeah.
So yeah, and it's getting worse nowadays. And so we just want to be able to support people out there on how do you really deal with, maybe if not mental health, maybe just the start of a mental health issue, which is just the stress, right?
Yeah,
And so
anxiety.
exactly, before it
hmm
becomes an anxiety,
hmm
depression, bipolar, PTSD, there's so many things that is so much worse than just stress. But let's not take away the importance of dealing with stress as well. So
hmm
maybe first things first, maybe whether Maricel or Bay, can you talk a little bit about what you mean by stress so that people are in the same language. We're talking about the same
Mm.
thing.
You
Yeah.
wanna go first, Marissa?
Yeah, sure. So stress means, it's a normal flight or fight and flight emotion that you get. Like if you get excited, if you got problem, you feel depressed. And especially now during these days, during pandemic, it's hard to go out from your own comfort, from your house, because we all know that it's not safe to go out. So when you feel alone, you feel depressed, you
Yes.
feel like malungkot kasi wala kang, no one will be around with you. And
Mm-hmm.
less socializing with all your friends, and like before you go out party there or just get together with your friends. Now you can't do that anymore. It's everything is online, so you feel depressed and you keep thinking about it, and now it become more and more, and very serious, that you can't sleep, so that's how I define stress.
Okay.
Wonderful.
So for me, stress is basically the response of either the body or the mind to external stressors, and um, it's really a problem. And for me, that's actually how my mental illness started with stress. Because
Mm.
I was such a young person and I was in the hospital in and out all the time,
Mm.
and that resulted in so much stress, which resulted to mental illness. So yeah.
Mm.
Mm.
Yeah, so maybe what is important for us to know is that when you don't manage stress, it can be a mental illness. So
That's
it's
right.
really important first, and maybe I want to also share my own definition and also what I got when I
Mm.
studied it as well, is that stress is, like Maricel said, it's a normal human response. It's our survival mechanism on how we react to situations or instances or emotions. So this is how your body reacts. But then when you are unable to manage your stress, when you're unable to manage your emotion, it now goes into different layers of stress, whether it starts with acute, then episodic, then it becomes chronic stress, and then
Mm.
if chronic stress is not managed, then it becomes a mental illness. So that's the reason why we really have to start with stress first, because everybody
Mm.
goes through stress. Actually, when I looked at the statistics, I saw nga there's like only 1%, I think, that I noticed, only 1% of the working class are not experiencing stress. Sabi ko, wow, ano kaya trabaho nila?
That's very
Diba?
interesting.
Yeah.
Imagine, ano kaya trabaho ng mga tao na to that they are not even experiencing stress during work?
Mm.
Wow! Or they're
Apply na
so
tayo
zen,
dun.
or they're so zen, right? They're like Buddha. They're like
Mhm.
Buddha, like a monk, that they're not ever stressed. Can you just imagine that you're working and you're never stressed? I would
I
love that to
know.
work.
Yeah, I think
I would
anyone would.
exactly. And
Yeah.
so looking at it right now, when you talk about stress though, in the way that you are, maybe you can share
Mm.
what are the things that really stresses you out.
Okay. So for me, what stresses me out right now is the fear that you might get sick or that your loved ones will get sick.
Mhm. Mm.
That's the number one thing that's really stressing me out.
Okay.
Yep.
So
How
it's
For
about you
really
me,
guys?
about the future, fear of the
Mm,
future.
yeah.
How about you, Maricel?
for me, I think it's financial.
Ah,
Financially, because I got kids and I got few properties that you need to manage. So,
Manage.
and we don't know. I'm just so lucky that all the properties that we had, the one that's renting, they haven't lost their job. Even we're locked down here in Australia, and they still continue paying rent. But in saying that, we're just so lucky that we're here in Australia, that we have a rental assistance as well from the government. That,
Mm,
yeah, especially now that people lost their job and everyone is locked down, they
yeah.
still have support. They still have support
okay.
from the
So
government. So half
lucky.
of their pay, they can get it. So that's
Wow.
every 15 days.
Wow.
We called
Wow.
it fortnightly. So
So
yeah, so
can I go there?
Sabay tayo,
yeah,
coach.
yeah, like yung mga retail na nagsara,
Mm,
na
Yeah.
nag-close down, they get support from the government. So we're
That's
so
so
lucky here.
wonderful.
Yeah.
mm.
So
So,
that's my worry. But
but so
anyway,
funny, Maricel, that that's your worry and yet you're getting support.
I know, but for the future.
Ah,
Yeah, and actually, I just want to share that to everyone. That
Yeah.
actually stress is about something in the future as well,
Yes,
because
yeah.
it's always us wanting to control something that is out of our hands.
That's right.
basically, right? We're
Mm-hmm.
stressing out about something that's not even there yet.
Happen.
And
It hasn't happened yet.
yeah, correct. And but that's so true, especially for me as well. I
Mm-hmm.
think it's really about financial well-being. It's
Mm-hmm.
Mm-hmm.
financial freedom. I think more than anything, especially since because of the lockdown, more so because of the
Mm.
lockdown starting
Yeah.
last year,
Yeah.
where everything is so uncertain. I shut down my business,
Mm.
my
Mm.
restaurant. It shut
Yeah.
down, lost it, right? And then now trying to look for another source of income because you want to be sure. I think that's a
Mm.
lot of people. Maybe
That's
that's a
right.
lot of people who are out there right now who are thinking, yeah, there's really something that I have to take care of. And so maybe the question to you is, how do you manage it before it becomes worse? How do you now manage it? Whatever you're fearful, whatever you're stressing out, how do you manage it that it becomes not worse?
For me, I think just making sure that I have these goals that I have to set for myself. Either it is for daily or weekly or monthly. Then I have to review that goals if I I achieve it. Like you know, or having. Uh, but for me now, because I had a baby, so I got lack of sleep. Sometimes I get so cranky, the patience. Kasi hindi mo maiwasan yun kasi may
Yeah,
baby nga, ayun. Yeah.
right, right.
Yeah.
Yeah,
So what you're saying is maybe look at your plans and review your plans.
that's
Okay,
right. Yeah, yeah.
sure. How about you naman, Bae? How do you
Um,
manage your stress?
for me, I talk to people about it. I feel like support from other people really helps. And then I
Mm,
meditate, I do yoga, self care.
okay,
Yeah.
right. So,
That's right. Oh,
yeah,
just to add on that too. Like I used to go out, with my kids and play outside just to have fresh air and have
Mm-hmm.
this, feeling of the sun in your body, in your skin. So
yes,
it really refresh you. Or sometimes listen to the music that I like.
yeah,
Mm-hmm.
Yeah.
yeah.
Mm.
So I think it really starts with that. So
Mm.
for me, I actually do both. So what I do is also what I cannot control, obviously, but I still look for something else. So for like
Mm.
for financial, obviously, you need to do something more than what you're doing right now. Hi,
That's right.
Sunday. I love Sunday. Sunday's always here. Thank you so much for
Oh,
watching us from Uganda.
Wow. From
wow.
Uganda. Thank you.
Yeah, so for me, I think more than the planning, especially if
Mm.
it's really not something in your control, it's also try to look for sources of expertise that you can reach out to that will support you so that you can move forward. Because if it's not in your control because you don't
Mm.
have expertise there, then look for expertise outside. Because
Yeah.
sometimes, like finding an extra source of income, and you have no idea, right?
Mm.
So you
Yeah,
actually need to look outside of yourself. Because sometimes we're too close, like when you're looking like this, you can't see anything else. So
that's
you have
right.
to expand your point of view. I think that's one of the things that I've learned for myself as well. And
Mm-hmm.
let go. And one of the major things is just surrender. Let go what you cannot
Mm-hmm.
control. At the end of the day, um, there's only so much you can do. You're only a human being. You can't do
That's right.
anything more than that.
Mm-hmm.
So so looking at that, no, I wanna talk to you, Maricel, and ask
Mm-hmm.
you, in your job in the public health sector in Australia, what's the first step or the journey of a patient who has mental health? How do they go through and seek help?
Okay, so we get different what is that sources that you can the pathway that you can go through. So either you call the mental health line. So the mental health line is a 24/7. So you can access on that, and they if it's not life threatening, or
Yes.
if a life threatening,
Yes.
if you call the mental health line clinician will call the ambulance, and they will send ambulance to your
Oh.
home. And if you don't feel safe after the assessment, the ambulance will take you to the hospital. So the hospital, the mental health hospital, they have an emergency department. Like I work in assessment unit.
Yeah.
So once we get this presentation presented by ambulance, if there's a magic word actually, that if you say to the if I'm a patient and I'll say to the ambulance people that I don't feel safe, I want to harm myself, I want to end my life. So that's become now under the Mental Health Act. Either we're going to detain you in the hospital, either you don't
Oh,
want it, or if you're willing to be in the hospital. So once we assess you, we go through the current assessment. If there's history of, you know, whatever history you have, or you
yeah.
already had a diagnosis, we have to detain you, and then we have to review with another clinician. So just to make sure that, you that you're really dealing with this mental health, you're in crisis at the moment, you need to detain yourself to be in the hospital for you to feel safe. So on the other hand, if it's just you just need to self-contain yourself just to be safe in the hospital. So we have this saying that if you say you don't feel safe, we have the duty of care. Duty of
Yes.
care, that if you let go, like if you want to be discharged on the same night that you presented to the hospital, we need to refer you to to the community health. So when you get discharged on that night, there's a follow up the following day. How you been going, So that's
Mm.
7 days
Yes.
follow up. And then we need,
Wow.
yeah, and then we link you to your GP. So your GP is your doctor, your local doctor, that make sure that your doctor is aware that you presented to the hospital with this
Mhm.
diet, with this, whatever presentation. If you cut yourself, if you whatever, yeah, so we get all these connections. So
Yeah.
Mhm.
in saying that, so we manage you from the community where, at your home,
Yeah.
and we do home visits as well if it's
Wow.
necessary.
Wow.
Yeah, if it's
Yeah.
necessary. So we have this community clinician that will go out and give you a call to make appointment. And if you feel safe to come for us to come to your house, or you want to go to the to the clinic for
Yeah.
us to assess you, just to check how you've been going, if if you need any help, if you need
Yeah.
medications, if you need a psychiatrist review, something
Right.
like that. So that's how the mental health here in Australia works,
I feel
yeah.
so
Wow.
wonderful. But maybe the question is, how
Hmm.
do you assess? How do you assess? So the person either
Yeah,
voluntarily goes,
yeah.
or somebody else can refer them as well, correct?
Yes, that's
And so
right.
how do you assess? How do you determine a person is in mental health crisis?
So we go through all this series of questions from the childhood history, so if someone had sexual abuse, history of sexual abuse, and then something trigger for tonight. For example, I deal with one time, I think some years ago, that someone presented. He's a teacher, he's
Yeah.
a teacher, a high school teacher, and he had trigger on that night. So he's been drinking, binge drinking during the weekend, and then took all the tablets, like he
Mm.
overdosed in front of his child, young
Mhm.
kids. And then he presented to the hospital and feeling like, he regret that he done that. But
Mhm.
at the same time, he's a teacher,
Mm.
and we have this duty of care that we have to manage his alcohol problem. And then we just found out that during the assessment, we found out that the trigger of that situation, that he presented to the hospital and then overdose, is binge drinking over the weekend, because he had a sexual assault when he was young. And then
Mm.
he
Uh-huh.
saw in the TV about Pell, the priest that doing the
Uh-huh.
sexual assault, and on
Got
the
triggered.
news, yet
Yeah.
that trigger him. So that's,
Yeah.
Yeah.
there's a domino effect of
Yeah.
how
Uh,
things
yeah.
going. So it just that doesn't happen overnight. There
Yeah.
should be so much trigger for you to have this meltdown.
Right,
Yeah.
Yeah.
right.
Yeah.
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 That's so basically what we're saying is the way that you assess is
Mm.
very comprehensive.
Yes, you have to
Mhm.
go to the history.
Yeah,
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 and you will find out if if they have um how is the background, childhood history.
right, right.
Yeah.
Mhm.
And maybe
Mm.
that's the one thing I want to share with everyone
Mhm.
who's watching. And you might be feeling that you have a crisis right now. Although the assessments in the internet are good,
Mhm.
it's
Yeah,
not as good as you talking to a professional,
that's
because
right.
the
Yeah.
professional
Yeah.
assessment is the one that's very important. And you know what, Marisol, when you were
Mhm.
sharing how
Yeah.
the mental health
Mhm.
support that you're getting in Australia, it's like what's this, a commercial to say go to Australia and live there. Can you imagine if
I know.
it's
Yeah.
mental health and this is how
Mhm.
they care for mental health? What about the
Yeah.
physical health?
Yeah.
I
I
mean,
know.
Yeah.
And we even get, international students, especially during this pandemic, that, going through meltdown because
yeah,
they stop the face-to-face learning,
yeah,
Uh-huh.
and
Yeah.
plus the rent that they have to go to. The
yeah,
family, they don't have support, so it's,
Mhm.
the support, the physical support that
yeah,
they getting through, missing out the family,
yeah,
homes, feeling
Mhm.
homesick. So
yeah,
and yeah, we got few referrals, international student, and you know what? We don't charge. It's free for them.
yeah,
Wow.
International student, yeah. And we got few anxiety, the one that going to the
right,
exam and go
Mhm.
and sit in the exam. When I was on the mental health line, I received this call one
yeah,
day that, he can't talk because he sit
Mhm.
on the exam, and he just get out from the room, and he said, I can't do the exam. But as a
panic
clinician,
attack.
you have to do the, deep breathing, what you can
Yeah,
Yeah.
see, what you can feel, something like that to help
yeah.
out.
So
Yeah.
I guess for everybody out there,
Mm,
if you hear what Maricel is sharing, it's all about those triggers that is causing
Mhm.
your stress or your mental health concern. Maybe it's about financial aspect, or maybe it's about relationship or missing the connection. And nowadays they use the word languishing, right? The
Mhm.
term languishing in
Yeah.
terms of mental health, feeling isolated and lonely, and
that's right.
it's like there's no purpose in life because you're stuck
Mm,
at home. And especially now we're on lockdown here in the Philippines and in Australia, right?
yeah.
So this is the time for us to really understand, if you cannot be physically present, what is it that we can do to make us feel uh, more comfortable and feel connected? What are the things that we can do as a nurse? What would you recommend for everybody?
uh, because we're locked down now, so everything is online. You get
Mhm.
connected to your friends. You go call your friend, and just start conversation. So that's very important to get connected. it's
Yeah,
it's all about connection. Otherwise, if you isolate yourself, like what should I do now?
Mhm. Yeah.
And it's not the end of the world. We always look forward for something
yeah,
like, if you get a hobby of doing gardening, go out and do your,
Mhm.
or you want to do cooking or baking, do it. Yeah.
yeah, yeah. And I just want to share, I think that's a very good point.
Hmm.
Because I also spoke with somebody like her issue was really more on, she's feeling that there's no more hope
Yeah.
because of the lockdown. It's like this is never gonna end. I might
Mhm.
as well just give up. That kind of
Hmm.
feeling. And
Hmm.
a lot of people might be in that state. And I just want to share. Maybe it's just also you defining your ideals, your expectations, because the mindset was,
Hmm.
I have to go out. If I
Hmm.
don't go
Okay.
out, it's the end of the world.
Oh.
Basically, that's her mindset. So it's
Hmm.
also maybe for you to understand what can you do in the limitation that we are in.
That's right.
So
Yeah.
if you cannot go out and with your friends, maybe let's do Facebook Live like what we're doing tonight.
That's
Like,
right.
right?
Yeah,
Well,
yeah.
I love this. I just love it.
let's do let's do Facebook Live just to feel connected, right?
I know,
Or
yeah.
and with more people, and then if they can just comment and interact with us, it'll be fun,
Yeah.
right?
Mhm.
Or
Can
we
just sing
can do,
along.
yeah, or we can do Zoom, right? Or G Meets, whatever it is that you want. I think sabi ni Zach, ayan si Zach, oy.
Hi. Ano sabi?
Sabi ni Zach, innovation and creativity. Tama
That's
naman, right?
right.
So
Yeah.
if you're limited because of how you are and you're always thinking it's limited, it's not for
Mhm.
me, right?
Yeah.
It has to be this and this.
Mm.
Then it becomes very heavy and burdensome.
That's
Then
Yeah.
you
right.
know for a fact that it's wala ng pag-asa. There's no more
Mhm.
hope, right?
Mhm.
Yeah.
But then if you change, what is it that will make me feel fun and joy,
Mhm.
even if I'm at home? I think that's the word.
Mhm.
Even if
Yeah.
I'm at home, what can I do to enjoy myself? Maybe
That's
binge
right.
watch Netflix. I don't know, right? Or exercise the whole day to
Yes.
increase your happy hormones, right? And reduce your cortisol, right? So what are the things that how about you guys? What are you doing
Mhm.
nowadays at home that will make you feel connected?
For me, I think it's really like Zoom,
Mhm.
G Meets. It's social media. I think that's the fastest way to connect with people nowadays.
Yeah,
How
same
about
here.
you?
Same
Uh,
here. And because we got my mom is here. She's been living
yeah,
here
certain.
for she's in and out. She's a tourist visa, but she
Okay.
have to exit for 1 year and come back again. But since this year she can't exit, so I have to extend her visa. So I'm just lucky that she's here, and I get support. With my
Mhm.
little,
Yeah.
with my baby, and with my friends here. Just go, Yahoo Messenger. Oh, sorry,
Mhm.
that's a Facebook, and then
Messenger.
yeah, and in the unit that I live, so we got a lot of Filipino here, Filipino moms with
Oh,
with
that's
small
really
kids.
nice.
So sometimes we just go down in the courtyard so we can play, but we have social distancing. We have to put
Yeah,
Mhm.
mask and
right.
social distancing, and we just go maybe 1 hour just for them to
Ah,
play with the kids as well. And for the kids, they have the play group Zoom
Mhm. Yeah.
every day. That's every day.
that's so
Yes, yes.
cute.
Wow.
That's for my
Oh.
4-year-old. They do the Zoom meeting and they do crafts.
4-year-old Zuma. I
Yes,
would
I
love to see
know.
that.
That's so cute.
I know
Yeah,
that's so
they sing.
adorable.
Yeah, they sing and they have storytelling. Yeah.
Oh,
Yes.
Wow.
That's how we feel
can you
connected.
record that? I wanna see it. That's so
Oh yeah,
cute.
sure, sure. Because that's Monday
So
to Friday, 11 o'clock.
that's so cute. And then
Wow.
Yeah.
Zach is saying meditation's been helping him
Mm.
create a feeling of connection and alignment.
Yeah,
And
that's
Zoom
right.
meetings and connection calls with friends also.
Mm-hmm.
So
Yeah.
I think for me, no, like
Mm-hmm.
let's say I'm working, and
Yeah.
even during work, I think even the even the meetings at work is really helping me because
Uh-huh.
even though it's about work, it's still asking them because you don't naman have a meeting and say, okay, what's the decision, what's
Mm-hmm.
whatever. You
Mm-hmm.
still
Mhm.
have to, like, we always ask each other, kamusta na
Yeah.
kayo, what's
Yes.
happening
Yeah.
with
Mhm.
you, and
Yeah.
we just have that connectedness. Maybe that's something that we can do for each
Mm-hmm.
other. And maybe one of the major things I want to share is when you're at home and let's say like me and my husband are the only ones here, you
Mm.
know, I I I make it a habit already to really ask for hugs. I think hugs
Mm-hmm.
are very
Oh.
important. And
That's
I just want to remember that kasi 'di ba sabi nga nila that it's really 4 hugs a day, 8 hugs a day, and 12 hugs a day. So you need 12 hugs a day is needed to thrive. Yeah.
yeah.
So and four is just for survival, right?
Uh-huh.
So that's something that can really take away, and when you try the hug, it really takes
Mm-hmm.
away the stress
That's right.
and the loneliness.
Yeah.
I think that's
Mm-hmm.
very important as well. That's why nga I'm really rushing to get a dog. Where's my dog?
Oh.
Yeah, I've been
What
I've
kind of
been
dog?
I've been stressing the unit association here to allow
Okay.
the dog so I
You need
can bring my
permission.
dog.
Yeah.
Yeah, exactly. I want a
Oh.
dog. I'm so demanding it right now. So so for the Facebook Live here, I'm just telling you, hello, I want a dog. Homeowner, approve it now.
Oh.
So I think that's important. So how about you, maybe Maricel, as a nurse? Maybe can you share with us what are the parang first aid? What are the
Mhm.
first things you do when somebody comes to you and they're already in a crisis? What are the first thing that you tell them to do?
Mm, that's a very interesting question. Like someone come to me. Um, we usually put them in the containment, containment area. We have a
Okay.
containment area that if they have the urge of self-harming, because we have all this, everyone that come, most of them, they have this self-harming behavior like cutting, you know. So we have to contain them in the containment area, and we have a nurse that one-on-one. So we have at least, what is that? 1.5 meters distance to see what you're doing physically. We can see your arms that you're not cutting.
But
So
this
that's
beyond that, you talk to
beyond
them.
that. Oh yeah,
Yeah.
yeah, for sure. You like, how you going through and do the assessment. Even if the psychiatrist is not present on that time, we just, do the normal talk that, how you going through, why do you ended up coming here. So all the sort of questions.
Mhm.
Yeah.
And
And to feel them that, there's a help that's available for them.
Mm-mm.
That's
so it's
very
really
important.
making them feel that there's somebody
Yeah.
out there for them,
Mm-mm.
Yeah, that's right. Yeah.
right?
Yeah.
And and for you, in terms of this, how many? Because
Mhm.
you mentioned that there are a lot of people that are going into self harm. Is that correct?
That's right. Yeah. Yeah.
Wow.
Yeah. It's
And
it's it's so here in Australia, I was shocked when I first worked in the mental health because I like my background in the Philippines. I was doing ICU and emergency. Then when I came here, when I was student, I was doing the old people nursing home.
mm,
Then
mm,
it switched my mind. What if I do mental health? And then I just love it, and it's so powerful that how the minds work.
yeah,
Uh-huh.
yeah,
Yeah, if they feel really hopeless and there's no future, I just
right,
want to end my life,
yeah,
and we don't have, I didn't see that in the Philippines. And even here we
Mm-hmm.
have eating disorders,
mm,
binging, and purging.
yeah,
And I did
yeah.
I
Yeah.
didn't see that in the Philippines.
I'm sure there is, but
Yeah.
there's no way for us to
Mm.
find out. So
Yes.
Yeah.
I think that's one of the things that's why this is very important for us
Hmm.
to do these lives, to really engage with the people, is to share with them what are the ways that we can
Mm.
self help
Mm-mm.
ourselves, because there's no government unit that we can
Yes.
run to,
Yeah.
right? There's nobody that we
Mm.
can talk to. And maybe that's why we always ask people that, if you have something that you want to talk to, reach out to
Yeah.
coaches,
That's right.
counselors,
Mm-hmm.
that
Yeah.
really will support you so that you can feel that there is hope, that you
That's
are
right.
cared for. I think
Yeah.
Yeah.
that's more important than anybody, right? Like you, Bay, like what were your experiences at the beginning, right? You were mentioning and sharing with us, but what is it that really gave you hope the most?
My mom. Yeah.
Mm-hmm. Mm.
Just knowing that she's there, she understands, and she never left my side. So
Mm.
yeah, that's what really kept me going. Knowing that if I stop living my life,
Right?
it would hurt her, and
Mm.
Yeah.
That's right.
that's something I couldn't live with. Like, yeah.
But what about maybe for those people who don't have that kind of support? How would you now, maybe for both of you, how would you
Mm.
share with them if they don't have that kind of support? How would you make them feel that there is support and there is care for them?
So here we sometimes, even if you don't have immediate family, we sometimes, you got partner or next of kin. It doesn't matter if it's to say like your relatives, like next of kin means, you have friend or a colleague that you can
Yes.
reach out. So we yeah, we tell them that, get connected, or if they come to the hospital and we need the next of kin, so we get the number, so we
Mm,
can tell them that when someone discharged, she need help and
mm,
she need,
Mhm.
assistance. So that's how we make them feel safe, and we give them the mental health line number that, this is 24/7, you can reach out anytime, and anytime that, yeah, that you don't feel safe.
right,
So
right.
yeah. Mm.
How about you, Babe? What tip would you give to those people? Let's especially here in the Philippines. No,
Mhm.
I know that although we are a very close knit
Mhm.
country, and although, but sometimes people still feel isolated, especially
Mhm.
nowadays, right? So what would you suggest or recommend to these people that are out there
Mhm.
right now listening?
For me, make use of the Facebook communities. There are a lot of communities.
Mm,
There's this one that I came across recently called Huddle Humans. And
Okay.
what happens is you just sign up, and then online you can talk about your experiences, and then other people who are going through pretty much the same thing
Mm.
are there to listen, and you all just share what you're going through. And sometimes it really helps to talk, even
Mm.
though the person you're talking to is a stranger.
Mhm.
Sometimes it's actually easier to talk to a stranger than someone you know. So,
That's right,
yeah,
because no
find
one will
outlets.
judge you.
Yeah,
They're
yeah,
not going to
exactly.
judge you.
Mm-hmm.
but
Yeah.
what if these people are not really that vulnerable
Mm.
Mm-hmm.
and they don't want to share? How what would you share with them in order for them to feel that they are still support?
Mm, I'd say um, journal. You have to be able to support yourself. I mean, at some point, you will probably encounter loneliness, or like sometimes there are people around you, but you still feel lonely.
Yeah.
So you have to have that inner peace within yourself. Na you're content with being happy by yourself, because happiness from external factors, it's fleeting. So you
That's
have to be
right.
able to support yourself and be happy with yourself. How about you,
That's right.
Maricel?
I think just for me, it's just focus on one thing at a time,
Mhm.
focus on what you have right now. Yeah.
Mhm.
And yeah, and I think keep writing, whatever in your mind, the journal. So that's what we encourage our patients that, get discharged, that do writing or whatever you feel. And some of them, they have this weight blanket that it really helps
Uh-huh.
for them,
Yeah.
to regulate the emotions.
Mhm.
And
Mm,
coloring, um, or knitting is good one
mm.
as well. Yeah, make your hands busy.
Ah,
Oh,
that's
Yes.
okay.
interesting. That's
Yeah.
something new. That's something
Yeah.
new.
Mhm.
Maybe the reason why they want journaling is so that your hands are busy and your minds are busy
Yes,
as
Yeah.
well.
that's right.
Yeah.
Yeah, yeah,
Right.
yeah.
That's very
Mm.
interesting. So now maybe on top of really just quieting the mind, it's really keeping the mind busy by journaling,
Mhm.
doing knitting, coloring, right?
That's
And I
right.
think that's something that's very interesting to hear. Yeah, I
Mm-hmm.
think that's
Yeah.
yeah. And sometimes kasi no, and I would say that there like what you said kanina Bay, that
Mm.
many times, even if there's so many people around us, there's still a feeling of loneliness inside,
Mhm.
right? Because I think there's really like our own, there's really the satisfaction in ourselves that no
Mm-hmm.
one else can fill.
That's
And
right.
so the only person that can give you that answer is yourself.
That's
Yeah.
right. Yeah.
And
Yeah.
in that sense, if it's just yourself first, maybe the way to go about it is really, talk to yourself, journal, like you said,
Mm,
and
mm.
try to read what you're writing. And then from there, talk it out to somebody else if you're willing, right?
Yeah,
Mhm.
But
that's
I
right.
want to share though that, like Brene Brown is always talking about vulnerability.
Mhm.
And it's true because vulnerability is actually a powerful force. It's not really
Mhm.
about your weakness. And
Yeah.
when you start sharing your own vulnerability, it's in that vulnerability that you are able to learn about yourself and that people are able to relate and connect with you. And that's really one of the major experiences that I've had in the past
Mm,
how many years lang. Na,
mhm.
because diba, when you're in corporate, you're always saying that don't show, don't cry, don't show
Mm.
vulnerability, or if you cry, you're weak. You shouldn't show that. It's kakahiya. Diba, yung mga
Mhm.
ganun.
Yeah.
Lalo na if
Mhm.
you're a girl, kakahiya ka naman just because you're a girl, you have to cry. That's so
Mhm.
kakahiya. Those are that's how I grew up with, and
Mhm.
so vulnerability was not really part of me, and so
Mm.
I all the burden, all the emotions you carry inside.
Mhm.
You don't
Mhm.
let it
Yeah.
out.
Mm.
And and if you don't do that, then it becomes a mental health issue as well.
That's
Like
right.
for
It's
me,
going to burst one day.
exactly. For me,
Yeah.
it was chronic stress.
Yeah.
I had burnout, chronic stress.
Mhm. Mm.
That was my experience, and so
Mhm.
that's why it's very important for me to talk about managing stress, mental health. It's
Mhm.
because I don't want anybody else to go through what I went through. Imagine mo,
Yeah.
every day I had super bad migraine,
Mhm.
Mm. Mm.
Mhm.
frozen shoulder, as in frozen. I can't sleep.
Mhm.
I wake up at 3 a.m. How bouts of panic attack. You can't sleep na. Then the next day you wake up
Mm.
at 3. You go to work, and it's
Mhm.
exactly the
And
same.
the
So
same.
Yeah.
basically number of hours of sleep is like 3 hours, 2 hours of
Mhm.
Mhm.
sleep, diba,
Yeah.
every day.
Yeah.
Mhm. I just want to add on that, mental health doesn't mean that, you have this mental health condition. Uh, Mental health doesn't discriminate anyone, either you're rich or poor, what level of education you have, you will get this one day. And
Yeah,
the same with the pandemic, either you're rich or poor, once you
Mhm.
expose to that virus, you will get it. So it's the same with the mental health, so that's why it's really important to get connected, and just even to the stranger, you just
yeah,
simply say, are you okay? It's just a
Yeah.
one question, that open-ended question, that you say, are you okay? And then someone will say, oh, this and that. And even though you don't solve that problem, someone is there to listen what you're
Mhm.
going through. And it's once you take out that feeling from inside, you feel like, I breathe,
Mhm.
yeah,
it's a good feeling.
Yeah. Yeah.
yeah,
If you know what I
exactly.
mean.
I
Mhm.
totally relate to
Yeah.
that.
Yeah,
I
yeah.
totally relate.
Mm,
I, I really like the way that you said, just ask
mm,
for even a
mm-hmm,
Mhm.
stranger. Just
mm-hmm.
say, hey,
Yeah.
how are you doing? Are you
Mhm.
Yeah.
okay? I mean, those are so important words.
Yeah.
Yes.
So maybe before we close and end, for those people that are out there, maybe still that maybe they don't know whether
Mm,
they're having any crisis or not, what would you tell them, all these people, but they're not feeling good, they're feeling a little down, they're
mm-hmm,
feeling a
mm,
little
Mhm.
hopeless, what would you like to tell them?
For me, there is hope. Um, at the end of the tunnel, there's always light, and you just have to figure out how you can cope. And whether it's by talking to someone, journaling,
mm-hmm.
you have to do something. You have to be your own hero, and you can change your narrative if you want to.
Hmm,
That's right. That's
I
right.
love that you can
I
change
think
your
you're right.
narrative. I love that.
Yeah, for me, just be grateful every day. When you wake up, you see the sun, be thankful for that. You feel the air, you feel the fresh air that you're breathing. Be
Mhm.
thankful for that. That's something very important. You need to be grateful every day. Yeah.
I think I wanna espouse that, but at the
Mhm.
same time I can say that a lot of people, we want to be grateful. Like me, I want to be grateful,
Mm,
but there are times when you're always comparing yourself and always seeking out what's not
Mhm.
there. So
Mhm.
I think one of the major practices really is start with forcing yourself to be grateful until you feel grateful. Because at the end of the day, sometimes we just don't notice, and the fact that you are able to have another day and wake up another day, it
Mhm.
means you have an opportunity to change your life.
That's right.
And
Yeah.
whether yesterday was a shitty day, maybe today will be a great day. And that's something that you should not pass on, because that's an
Mhm.
opportunity for you to experience maybe a great and wonderful day. You never know. So, for me, for tonight, I really want to thank you, everybody, especially Maricel, who's imported from Australia.
Oh, thank you. It's my pleasure, Charlene. I just
I
enjoy
love
it.
I loved having our
I
conversations,
know this is my
Maricel.
sanity.
I love it. So I guess, Maricel, you're one of my major guests now.
Anytime, just reach out.
Yeah, I love talking to her. It has been such a great and wonderful conversation with you. Thank you so much for saying yes. And of course, our co-host every month, Bay. It was such a wonderful conversation, and I really love the way that your journey. I've noticed
Yeah.
how you've grown so much.
Mhm.
And for everybody who's out there that hasn't seen it, please watch and share. For if you have any comment, please comment and we
Mhm.
will get back to you. But more importantly, if you have somebody who's out there that you feel who's really having this crisis, whether it's mental or emotional crisis, please reach out and share this Facebook live to them, and maybe
Mhm.
there is something in our messages that can reach them, and you are the one that will bring them hope. So for tonight, thank you so much once again,
Yes,
and
of
see you
course.
next week, everybody, on our next
All
Facebook
right.
Live.
Bye. Nice meeting
Bye,
you, Bianca
bye.
and Patrice.
You too,
Bye.
Maricel.